हेलो फ्रेंड्स। आप बैकग्राउंड में नॉइस सुन रहे होंगे, दैट इज ईईसीपी मशीन इज रनिंग। हार्ट फेलियर पेशेंट इज टेकिंग ईईसीपी who was advised bypass surgery. Her pumping was 30%, but now she has recovered and EECP course is on the way. 35 sittings of EECP needed Monday to Friday, 1 hour, and that is FDA guidelines. But what I am going to say that आपको स्टेबल कंडीशन में चलने से एंजाइना हुआ या घर पे चेस्ट पेन हुआ, then you go to hospital, emergency medicines, आपको अपने एक हाउस इमरजेंसी किट में रखना चाहिए, जिसमें इकोस्प्रिन 325 अथवा डिस्प्रिन की एक स्ट्रिप, देन टाइकाग्रेलोल ब्रिलांटा 90 की एक स्ट्रिप, एटोरवास्टेटिन की 80 मिलीग्राम की एक स्ट्रिप, बिटालॉक 25 मिलीग्राम की एक स्ट्रिप और सॉर्बिटेट 5 मिलीग्राम की एक स्ट्रिप आपको रखना चाहिए घर में फॉर हार्ट पेशेंट्स, those who has family history of heart, diabetic, obese, stressful, sedentary lifestyle people might have need of these tablets. So when you feel that you are crushing chest pain and with perspiration is must. Simultaneously tachycardia, vomiting, nausea, impending doom, कुछ पत्थर पड़ा है छाती पे ऐसा लगे तो immediately you can take Ecosprin 325 or Disprin. You can chew it or crush it or take it water. Then take 2 ticagrelor Bilanta 90 milligram tablet and 1 atorvastatin 80 milligram tablet. Then immediately call 108 and take ECG and give sorbited half if BP is normal, and if heart rate is high, give Bitalog 25 milligram, and then rush to hospital and take 5-inch specific thrombolytic if ST elevation, or do angioplasty in golden hour. And if non-ST elevation, nothing to worry. Take 7 days course of antithrombotic injection and antiplatelet drugs and BP and diabetic drugs if you have, and that can prevent future cardiac events. But in stable condition, people are trapped in hospital and go for angiography, and they show multiple 99, 100, 90, 80% blockage, and they trap in stenting or bypass. That is not needed. Intensive medical treatment, as declared by clinical trials of like ischemia, courage, Saturn, reversal, asteroid, that reduce blockage, stabilize blockage, prevent heart attack, and simultaneously with medicine take alkaline diet, plant-based, avoid junk food and deep fried food and non-veg food, fried non-veg food, and take EECP after 12 days of angiography, because they have reached the radial or femoral artery, so jet flow of blood will come out. So 12 days is FDA guidelines after angiography EECP to be taken, and it should be taken by trained doctor. There are mushrooms of center, but that are franchises and run by notorious people. So take with trained doctor, and you will get best result in improving heart failure pumping, developing natural bypass, removal of symptoms. I have one patient right now. She has been bypassed before 20 years. 4-5 years was okay. Then she has pain. She had pain. Then again she was stented before 2 years. After stenting, she has to take 20 sorbitate per day to relieve her chest pain. Then she heard of my name. Her son took her to my consulting, and I advise EECP, and she is right now on the completion of EECP. 10 sittings are due, but from the 5th sitting, her sorbitate are totally stopped. She has not taken any sorbitate. So you know the work of EECP, develop collateralization, develop angiogenesis, develop arteriogenesis, reduce afterload, reduce cardiac hypertrophy, reduce inflammatory markers, develop new vessels by growth factors, different type of growth factor and stem cells, and open culprit artery, blockage artery, it opens. So it's a wonderful modality. It has been explained by FDA, renowned scientist. Some bypass surgeon keep EECP machines at Bombay or Chennai. So it's a wonderful treatment, scientific, deep-rooted treatment. You will get maximum benefit with EECP treatment, either in diabetes, either in kidney disease, either in heart failure, or developing natural bypass, or ischemic stroke. It is a wonderful treatment. And if you have peripheral arterial disease, there is a protocol to give EECP. It gives excellent result. So EECP is good for whole vascular system, and without emergency, stable condition, person has to prefer EECP instead of this invasive procedure, because that is damaging the myocardium. And after invasive procedure, people are coming towards us to take EECP as our expertise in heart failure and developing collaterals and rejuvenate the heart. Thank you.